With Kelowna Mayor Colin Basran. Mayor Basran, for the last almost 2 years now, we've had many conversations about COVID and restrictions and what the city would do. And you have always been one that has sided with the provincial government and provincial health orders and following those mandates. That being said, we're in a situation right now where interior health, or the interior of the province, is being held back, some will say, from capacity, being held back at 50%. How frustrating is it for you? I know it's frustrating for many in the community. I'm sure you must be there as well.
Yeah, well, certainly frustrated, but maybe for different reasons. Frustrated continually with the fact that our ICU is full of unvaccinated individuals, and we know that our healthcare workers are burnt out. I just had the opportunity to go and deliver some treats and some thank yous to our healthcare workers at our urgent primary care center, just to thank them for coming to their shifts every single day to care for us when we know they're burnt out, they're exhausted. So I understand, though, people's frustration, and I think where there is maybe a continuation of this frustration, or it continues to build, and what I think is lacking perhaps is just a bit of communication from Interior Health. I think that Dr. Sue Pollock has done a tremendous job of guiding us through this, in light of the fact that Dr. Bonnie Henry has allowed for sort of regional restrictions to be kept in place. However, that being said, what I believe is missing is regular updates with the community to let us know the reasons why. And I think that's the big question that people are frustrated not getting the answer to, is why is the interior still under these restrictions? And that's not a question for me to answer. That should be answered by Interior Health, and I think that's where the frustration is building, is why.
I know the media has been asking, and I know you've been asking, MLAs have been asking, there's been letters, there's been phone calls, there's been communication. What are you being told?
So I'm being told that it is for the very reasons I've discussed, that the ICU is full, that we are healthcare workers, they're getting burnt out. Mm-hmm. And so as a result, I think it's safe to say that the hospital is not running with the amount of staff that they probably would like to have there. This has now been stressed even more by the fact that people who have been unvaccinated and previously were working in healthcare are no longer working in healthcare, adding even more of a burden onto their colleagues who do believe in science and have done the right thing. So there's a number of factors, but again, it's the public, and namely those businesses who are being impacted by this, event operators like the Kelowna Rockets and others. They deserve answers, and right now we're not getting any. And again, I'm trying not to be critical here of Interior Health. They have done a tremendous job through this pandemic and are doing amazing work. But from a communication standpoint, the community wants to know, why are we still having these restrictions when everywhere else in the province is not?
Are you hearing whether there's a potential time frame? Every time Bonnie, Dr. Henry takes the podium, people are kind of on edge. Will this be the day? Will this be the day? Are you getting a sense that it could be a week, could be 2 weeks, could be 6 months?
Unfortunately, I have no sense of when these regional restrictions will be lifted. All I've been told is that when they will be, we'll be notified. But that's all the information we're getting. But again, Wayne, I want to be very clear here. The purpose of me saying this is not to criticize Interior Health. I'm just saying politely that we would just like an explanation. People in our community would like an explanation because they're frustrated, because they don't know. And businesses are losing money. Again, we're in a health crisis, so I completely understand and have always supported Interior Health and our provincial medical health officer. But I'm just asking if we could please have some public information shared with the community so that we know the reasons why.